Hello, it's me again, Phil Jacobus, here at Healthcare Business News, and today I have the good fortune to be joined by Hakan Ilkin. Hakan, thank you for joining us.
Thank you very much for having me.
Uh, how do I pronounce your name correctly? Am I
Hak-
correct? Hakan.
yes, it's
Okay,
Hakan. Yes.
Hakan. So Hakan is the president of Bright Hospital, and Bright Hospital is a really interesting company that offers uh, an, an interesting service. When I spoke to him about it, he said that we help hospitals improve performance improvements driven by analytics. What could be more timely than that? So, Hakan, tell us about your company, please. Just in a few words, what's the service you offer?
So we provide cutting edge subscription analytic services to improve hospital operations, and especially to improve patient throughput in surgical services and emergency departments. So we try to help hospitals be more efficient in these very high cost or high patient throughput areas and be able to do more with the resources that they have.
And how do you do that? Tell me about how you do that.
So my background is I'm an industrial engineer that has been working with hospitals for the last 25 years. And last 25 years, I've been trying to research methods to improve hospital operations. So in Bright Hospital, what we designed are basically analytics that are specifically aimed at addressing key points in hospital operations that have the biggest impact in patient throughput. And we provide those analytics and also provide the know-how that is necessary to address those key levers within hospital operations so that they can improve hospital operations.
And where do you get this data? Where do you get the data in order to analyze?
It comes from hospitals' own sources. It is depending on the subject that we're working on, it comes from their surgical information systems, from their EMRs, and other sources that we're using that are needed to create the models that we are generating.
Is this easy for the hospital to provide you with this data?
Yes, it is. We are not looking for any complicated analytics or anything else. We are always looking for raw data and just from existing sources.
And I suppose it's all HIPAA compliant.
Absolutely. We try not to get any PHI from the hospitals to begin with, so everything is HIPAA compliant.
So you receive this data from historical data, and I assume current data, and then you analyze that data, and what sort of information do you provide the client?
I'll give you our latest example, which is our surgical services forecasting model, which we design. We get the data and create a model for individual hospitals where, blended with the current information, they can have a complete visibility of what their surgical pipeline is going to be into the future. And with that information, they can make the very important decisions on, okay, I have a specific date and time that is being underutilized. What do I need to do? Do I need to go and market my time more effectively? Or do I need to right-size my staffing? Or do I need to do some other strategic decisions? So now the hospitals with our tools have, with our information, has tools in their hands that, instead of managing surgical services in the traditional retrospective way, they can manage it in a proactive and looking into the future.
Now, how has your business model reacted to the COVID-19 pandemic?
It has been actually very effective because we are able to provide analytics to hospitals that show exactly what is going to happen into the future with COVID impact. So our models, especially in the forecasting, goes into the, for example, surgeons' clinics. And if there is any impact due to COVID to surgeons' clinics, those forecasts reflect the changes that are going to happen in that demand literally overnight. So that has been an important tool for hospitals to see what is coming at them and be able to make strategic decisions and changes.
So this is almost like blending industrial engineering and healthcare.
I'm truly trying to do that. Yes, exactly. It is.
Do you have, if someone reached out to you, have you done studies on this sort of thing to show your results, or?
We have, in previous models, we have done many results, and in our current models, we have very good analytics that show that we are within plus or minus 5% accuracy with our forecasts up to 4 weeks out.
And I think you told me that you can reshuffle the data overnight.
Yes, because yes, the models are applied on data that is extracted on a daily basis. So whenever you get your analytics at the beginning of the day or whenever you want to see it, it is, you are looking at the data as of today.
And who do you typically interface with? Is it IT, or is it the practice manager? Who do you typically interface with?
It is, in one of our hospitals, the forecasts are going to over 50 people that include anywhere from OR scheduling, OR leadership, to surgeons themselves, surgeons clinics, COO, CMO, the IT director. So it turns out everybody is very interested in what the projected volume is going to be from surgical services. And they all have specific decisions that they need to make on a daily basis, depending on what is coming at them.
So this sounds like a really interesting service to me, software as a service. Mm-hmm. I'm really impressed that you were able to come up with the idea and put it together. And I hope you'll come back in the future and tell us and give us some examples of how your new program is going.
I would love to do so. Thank you very much for the opportunity.
And thank you, and thank you for spending time with us.